Good afternoon, everyone. It's a pleasure to be here today. My name is Vivek Murthy. I am first and foremost a proud member of Organizing for America, and very happy to see so many volunteers here today. I'm also a resident of Brookline, Massachusetts, not too far away, and a physician at Brigham and Women's Hospital. I was a volunteer during the Obama campaign, like many of you, and one of the things that I worked on there was to start an organization called Doctors for Obama, which brought together 10,000 physicians in support of the Obama health plan. Since then, we have continued our work as Doctors for America in an effort to bring even more physicians together, to work with local communities and to work with groups like Organizing for America in making sure that health reform is a critical issue that's discussed in communities and an effort that's passed this summer when the legislature votes. Now, health reform, as all of you know, is a critical issue that's under debate right now, and an issue that all of us really need to be engaged in if we're going to get serious reform to pass. The detractors of reform are speaking up increasingly loudly, and that's why it's important for us to know what real health reform is about and how we're going to get it done. And to help us in this regard, we are very fortunate to have with us Professor David Cutler. David Cutler is a preeminent healthcare economist at Harvard University. He has also served on the Council of Economic Advisors and the National Economic Council during the Clinton administration. He was also an important advisor to the presidential campaigns of Bill Bradley, John Kerry, and most recently Barack Obama. And I should note on a personal note that David Cutler was also one of the key figures in helping to bring together Doctors for Obama. So we deeply appreciate all of his work and advocacy on health reform. Please welcome David Cutler.
Thank you, and thanks for all the work that you've done. It was phenomenal. I remember when we got our doctor from the 50th state, which turned out to be South Dakota. Senator Daschle was very pleased to know this. We almost had to call him to enlist his own personal doctorate assignment. How is everyone today? All right. I want to talk to you about where things are on healthcare reform. This is going to be a huge, huge battle. And so I'm going to give you a little bit of ammunition as you go into it. Let me start off with successes. We elected Barack Obama president in part because we wanted to see action on healthcare. What's happened so far? In all the years of the Bush administration, they wouldn't fund expanded coverage for children. Within the first week of the Obama administration, that was funded. We now cover millions more children. As part of the Economic Recovery Act passed in the spring, there's money for unemployed workers, laid off workers to be able to buy health insurance. There's money to start redoing the healthcare system with investments in information technology, learning about which things work. It started to pull this together. That's because of the work of people in this room that we're one step closer to where we need to be. So you should feel proud. I feel proud to have been a small part of it. What is coming now is the major battle, and that's going to be for fundamental healthcare reform in the country. And it's happening this year. It's playing out now, and it's going to play out over the next few months. And so let me tell you a little bit about what's up. The Obama administration decided absolutely correctly not to write a bill within the administration, send it to Congress, saying, please pass this bill. It said, look, here are the principles. I laid out these principles on the day I started running for president. These are still my principles. I want there to be a bill that follows the lines of these principles. The principles are that, number one, we should save money in the healthcare system so that everybody can afford it and we don't spend more than we have to. Number two, that we should cover all Americans, put ourselves on a path to covering all Americans. Number three, that the quality of medical care has to go from haphazard to uniformly excellent. Okay? That is what healthcare reform is all about. That's what he said. Both the House and the Senate are now working on this. The Senate is where most people are paying more attention to because the Senate is a more split body. Even if there's 60 votes for Democrats, that doesn't necessarily mean that something will go through. There are two committees with jurisdictions over healthcare in the Senate. The first one is the Senate Finance Committee, which handles taxes and mandatory programs of which Medicare and Medicaid fall in them. It's chaired by Max Baucus of Montana. The second committee is Health, Education, Labor, and Pensions, chaired by our own Senator Kennedy, who has been unbelievably remarkable on this, and he's devoting, as best I can tell, about 200% of his time to healthcare these days, and he's doing so extremely effectively. Senator Baucus and Senator Kennedy have agreed they're going to work together. They're each crafting the bills that their committee needs to do. So some of it goes to the Finance Committee, some of it goes to the Health Committee. They're then going to merge them together. They're going to mark up their joint bills in the committee by June, and then they're going to bring them together to the Senate floor with a debate coming this summer and on into the fall. Okay. So and I'll tell you a little bit more about the deadline, but it's coming this summer and into the fall very quickly, very, very quickly. The House is also working on healthcare reform. The House has a couple of committees, but they're producing one bill. By virtue of the representation in the House, it'll probably be a little bit more of a liberal bill in the House than in the Senate. At the end of the day, they'll have to put them together and try and reconcile them. As you all know, in the Senate, for a regular bill that comes up, a bill has to have officially 50 votes, 51 votes to get passed, but and a filibuster has to have 60 votes. So the question is what to do about that. Now, there is a way that you can use only 50 votes, and that's what's called using a budget reconciliation process. So earlier this year, you probably heard a bunch of discussion about should healthcare go in the reconciliation process. The Senate and House passed the reconciliation bills earlier, and they said, before October 15th, we would like to have the regular rules for a healthcare bill. But if the Republicans are just going to block things and not allow a vote, then after October 15th, reconciliation provisions would apply to healthcare. Which was an absolutely huge statement for them to make. So what they're saying is, we want something that's bipartisan. We are willing to work with you. The Republicans in both of those committees are very involved. We want to work with you. We want this to happen. But if at the end of the day you're just going to say no, we are just going to do it.